Thank you, President. Thank you, colleagues and friends. Receiving the President's Award is a huge honour. This award recognises the work of many people who share a belief that something as fundamental as breathing should not depend on where you're born. So, in accepting this award, I would also like to share a little bit of our story and what continues to motivate us. And to start today, I want to go back a bit in time to a very different place. In 2008, as a junior doctor, I was working with Médecins Sans Frontières in Darfur, Sudan. This was just after the Darfur genocide, where 300,000 people had been killed and millions were displaced. But what struck me most as I worked in the field hospital there was not the violence, which was continuing, but the ordinariness of most deaths. Children dying from pneumonia, malaria, sepsis, malnutrition, childbirth complications, conditions that are easily preventable or treatable with basic health services. Yet access to these basic health services was grossly inequitable. Even relatively well-established field hospitals like ours lacked basics like pulse oximeters and reliable oxygen. This experience was a stark reminder to me that health outcomes are shaped far more by power than by pathology, and it etched into me a lasting desire to confront health inequities. In the years since, oxygen became my essential medicines obsession. Used clinically for over 100 years, oxygen is a strange medicine. It's never been patented, doesn't have a commercial champion, it's not glamorous, there's no definitive clinical trial, and yet it is absolutely essential to our care every day. Working with colleagues in Nigeria and Papua New Guinea, we focused on deceptively simple changes. Reliable pulse oximetry, simple oxygen supply systems that locals could use and maintain. And the result, in about 30 hospitals that we worked, was a 50% reduction in the hospital pneumonia mortality in children, and results that were sustained at 5 and 6, 7 years after. Not through new technologies, but through basic systems that worked. Now, critically, this was only possible through partnerships with local clinicians. And I need to especially acknowledge Professor Falade and Dr. Bakari, who continue to lead our research in Nigeria and always pull us back to what matters: children, families, and communities. I also need to thank Professor Trevor Duke, who introduced me to the world of oxygen and really shows me what impact-focused partnership, long-term partnerships with communities and colleagues means. Now, these early successes in these hospitals raised a bigger question. Why aren't these oxygen basics everywhere? So our team in Nigeria joined with colleagues and government stakeholders to attempt something bigger, the world's first national oxygen strategy. This was new ground for me, meeting not just with clinicians, but with government officials, development partners, funders, talking about financing, supply chain, power infrastructure, health information systems, policies, and politics. Progress after the launch of our first national oxygen strategy was slow, painfully slow. Oxygen remained virtually invisible to the global health community until COVID. COVID forced the world to confront what frontline healthcare workers have known for decades. Oxygen inaccessibility is not an acute crisis, it's a chronic systems failure that has claimed lives for generations. In the COVID period, the global response was slow, but it eventually came with the tune of billions of dollars being invested in oxygen. And too often, this too was misguided. Ventilators sent to facilities that lacked basic oxygen. Oxygen production plants delivered without power or engineers to operate them. Funding concentrated in large urban hospitals, exacerbating the existing inequities in small and regional facilities. Big, beautiful investments that would require 4 times that investment from local health systems just to run and maintain. So COVID was a catalyst for awareness, but money without strategy became extremely problematic. For 2 years, my work pivoted almost entirely to pandemic oxygen response. World Health Organization guidelines, a World Health Assembly resolution, advising donors and agencies, and eventually helping to launch the Lancet Global Health Commission on medical oxygen. In February last year, we launched the Commission report, for the first time putting numbers on the global oxygen inequities and mapping out a clear agenda for action. We found that 1 in 5 people worldwide do not have access to basic acute care oxygen services when needed, and long-term oxygen services are virtually non-existent for all but the world's most wealthy. But the findings were not all bleak. The good news is that each dollar invested in basic oxygen services can produce a $21 return on investment. And crucially, the priority investments are not more large production plants, but local investments in how oxygen is distributed and used, with universal pulse oximetry being really the lowest hanging fruit. This work pushed me into advocacy, and I learned something critical. Evidence does not speak for itself, and power listens very selectively. That lesson was reinforced by working alongside experienced advocates like Leith Brinslade and Every Breath Counts Coalition, people who know how to translate evidence into influence and how to get those with knowledge and lived experience into rooms where decisions are made. Now, through all this, I've tried to stay grounded in clinical work and genuine partnerships. And I want to thank our International Child Health family, particularly Shiraz Badruddin, who leads our work on safe oxygen for neonates, Rami Sulpi, Priya Kubat, Mick Burhan, who lead our work integrating oxygen into broader paediatric emergency care systems, and the teams we work closely with, particularly in Nigeria, Uganda and Cambodia. I also want to thank some of my mentors, Amy Gray for expanding our thinking on education and leadership, Barbara McPake and Freddie Sanguba, who really push us to think more about systems and complexity, Steve Graham and Joy Vaughan, who showed us what principled advocacy and partnership means over a long time, and Shay Abimbola, who challenges us to think about what knowledge is valued and whose voices count. And of course my family, my wife Mariam, my daughters Zadie and Amira, who always ensure that girls and women are forefront in my mind. Health is political, whether we like it or not. To quote Rudolf Virchow, medicine is a social science and politics is nothing but medicine on a large scale. Politics determines who gets oxygen, who survives pneumonia, who makes it to adulthood. Inequities are everywhere, and drifting with the status quo will only entrench them. And this matters now more than ever. We are living through a volatile moment. Science is being undermined and challenged. Hard-won gains in gender inequality and multiculturalism are under threat. New technologies are racing ahead of ethics. Violence and suffering are normalised again and again. It sometimes feels, and fitting with tonight's gala theme, like a return to the Wild West. But disruption also creates openings, and with COVID, didn't magically fix oxygen access. People fought for it and continue to fight, but it did provide an opening. As I look around this room, I see doctors, nurses, physiologists, researchers, scientists from all different backgrounds and disciplines, here united with a shared purpose, helping people breathe. We hold enormous privilege and therefore responsibility. Beneficence and justice, these are core principles of medical ethics. It makes the struggle towards health equity everyone's business. This isn't just nice to do or charitable. This is everyone's business. On this, we cannot be neutral. Inequities in health are everywhere when we start to look. But today, I want to end where I began. Darfur. I wish this story ended well. It doesn't. Darfur is again experiencing mass violence, driven, as before, by men with power, weapons and impunity. Moments like this can tempt us to withdraw, to focus just on our labs, on our clinics, on our science. But equity asks us to also look outward, to listen to those living these realities, to hold on to some simple truths, that every life has equal worth, that violence against children is never acceptable, that health is a human right, and rights need protection. This award belongs to a community that believes breathing should not be dependent on geography, income or politics. Thank you for the honour, thank you for your work, and thank you for continuing to insist in clinics, labs, wherever you go, that every life has equal worth. It's a privilege to share that work with you.